Hello, I'm Nikki. I'm a dental hygienist here at Perfect Smiles. Initially walking into our rooms when we are utilizing a clean room to seat patients in, we usually like to have our computer screens on the Perfect Smiles website that shows the comfort amenities behind the patient and also the side monitor in front of the patient. Initially when seating in the room, whether I'm bringing the patient in by myself or if the front desk has already seated the first patient of the day, I do like to stand up for this part of the appointment, and I do utilize this back computer. It allows me pretty easily to kind of rotate it, so I feel comfortable with this. I typically stand and review the medical history, so this allows me to easily access any of the paperwork that's behind the scenes, behind the patient. One, it just allows me to make sure I have the correct patient's chart, reviewing health history without the patient's eyes always on the schedule. Typically we do blood pressure, so it's just easier for me to stand as I'm kind of finagling this portion of the appointment. I can easily look up their family file, any comfort menus that I know of, or any personal notes with the patient. But also, of course, anytime we're working on the patient, I like to involve them as much as I can as well. When it comes time to, after the initial taking x-rays, going over the health history and starting the scaling portion or hygiene portion of the appointment, that's when I will rotate this back to the standard position. I'd get the patient back into the chair, and when I start the clinical aspect of things, I certainly do use the side monitor a lot more, not only for patient education, but this allows me to see the x-rays a little more up close. It's just easier to maneuver the keyboard that is right underneath here. It allows me to slide and rotate it easily, so it's not in my way, to allow me for perio charting or any type of notes. So this works really well when I am behind the patient. This can just easily move a little bit out of the way to allow me to properly see at the 12 o'clock position, all the way kind of until about halfway. When I start getting here, that's when I'll just be careful of my surroundings, get things back in. And there are times when I'm working from this position in the patient that I do like to have my x-rays or perio charting or any other clinical information that I need on that screen as well. I feel like if I'm by myself, it's a little bit sometimes difficult to reach on this side while I have the patient to access the mouse. So there are cases where I can easily slide this right over here without any type of interference, and I can easily do everything very effective through here. Perio charting, looking up their information, checking out the x-rays. If I'm not able to do that, it's very easily able to be done here. Anytime before sitting the patient, I always bring it back to this standard position. Both screens are very important, and they both have their functional pros and cons, of course, but I do like to utilize both at every appointment. When bringing the patients upright at the end, we just kind of slide everything out of the way. We do typically use our covers that we clean and wipe down at the end of the appointment, allowing the front desk or treatment coordinators to then complete in-room checkout.